Clinical example, we have a female 18 years old. A young girl complained of problems with urination for 4 years. She was unable to pass urine even when she had a full bladder. She had been catheterized on several occasions with this problem and now had an abdominal catheter. Though she was quite introverted and spoke very little, we also found out that she had bowel movements only once in 5 to 6 days with laxatives. She had had menstrual bleeding only twice in her life after age 14. It seemed that the patient's large intestine, bladder, and reproductive organs, which are related to kidney and urinary bladder, had an elimination problem. Elimination is a function, the yang aspect. If the yang in the large intestine is improved, then the bladder function could improve as well. Okay, so as you can see on the tower diagram and the schematic cycle of the mother tonifying the son. Treatment, Li4, stomach 25, and triple warmer 6, which are symptomatic points against constipation. We use Li4, the great eliminator, bladder 28, needle and cupping, because this is the back shoe of urinary bladder, paravertebral tapping of lumbar 2 to sacrum 4 with plum blossom needle. This improves the function of internal organs in the area. So it's from lumbar 2 to sacrum 4. REN 3, sedation, the front viewpoint of the urinary bladder. As the mother organ, the large intestine improves its function. The son organ, the urinary bladder, receives this chi and its function improves as well. So it's from the Li to urinary bladder. All the above cases are examples of tonification of the mother as a sufficient measure in cases in which mother and son are both deficient. So sedation on the mother cycle. So for the yin organs, we have lung 5, heart 7, liver 2, kidney 1 or 5, spleen 5, and pericardium 7. Sedation points on the young organs, Li2, Si8, GB 38, UB 65, stomach 45, triple warmer 10. If an organ has excess of yin or yang, it has the possibility to send the excess away to its son. If the excess state persists, there can be two reasons for this. First, there may be a block in the flow between the organ and its son. Second, the son organ may also have an excess state. Therefore, it is not possible for energy to flow from where it is in excess to where there is again an excess. Okay, let's consider a case of lung edema or fullness and excessive mucus in the lung. This would be excess of lung yin. It also means that the yin does not flow down to the kidney, which is the son organ. We could send this yin away from the lung to the kidney by sedating using sedation needle technique, lung 5, the water point of the lung. This will unblock the energy flow between the two organs. Sedating lung 5 in the yin organ will sedate both yin and yang of the lung. But since lung and its son kidney are both yin, it will sedate more of the yin and only a little of the yang, like 90:10, which is fine. But if the patient already has water retention and general edema, then the lung edema or excessive mucus is because the lung cannot descend water to the full kidneys. It therefore becomes necessary to improve the kidney function by using bladder 23, the back shoe of the kidney, and bladder 58, luo connecting point, to increase urination. Or one could simply sedate kidney 5. The sedation of kidney yin or the increased urination would instantly and automatically reduce the lung edema or the excessive mucus in the lung. Kidney 1 is generally not used with sedation technique, as some trials have shown that after kidney 1 sedation, sometimes the kidney function does not return to normal for a while. In growing children, it is forbidden to sedate kidney or urinary bladder, as this energy is needed for bone growth. In adults, when kidney yin needs to be sedated, one could sedate kidney 5, the she cleft point.